All right, guys, we're going to go ahead and get started today. The topic of the day is prevention and treatment of high cholesterol, saving lives through Life Simple 7. So, little background. My name's Dr. Fritz. I am a cardiac anesthesiologist, also on the Associate Board of the American Heart Association, and a trustee of the Disque Foundation. Our mission for the foundation is to empower everyone to be able to save a life. So very basically, we train people in CPR, BLS, ACLS, PALS, first aid, all that kind of good stuff. We try to make that available for everybody to be able to do at no charge at all, like no matter where they live in the world. As long as you have an internet connection, you can learn how to do that. So that's our main mission. That's why we're here. So today, we're going to be diving deeply into cholesterol. I've left plenty of time for question and answer at the end. I have a little area right over here where you can type in your questions. You can send them either to me or to everyone, doesn't matter. Go ahead and put questions anytime you'd like. If you want to click your audio to where you can speak back and forth, that's completely and totally fine as well. You can stop me at any time. Otherwise, there's plenty of time, like I say, for question and answer at the conclusion today. So we're going to jump right in. We'll go ahead and get started. So prevention and treatment of cholesterol, basically, why is it important? Who cares? To set the stage a little bit, top 10 causes of death in the United States. Heart disease is number 1. Stroke is number 2. Both of those kind of fit into the stroke and cardiovascular disease area, making it kind of a big deal when it comes to just overall deaths, cause of deaths in the United States and also globally as well. So as far as the AHA and their kind of part in this, their mission, their kind of strategic goal for 2020 is to improve cardiovascular health for all Americans. By 2020, they're wanting to reduce it by 20%. So it's a pretty big, to reduce the number of actual deaths associated with cardiovascular disease and stroke is pretty lofty goal. So that's pretty amazing. Really stoked about being involved in that mission. And what they've identified is they have 7 key factors that can lead to what they call ideal cardiovascular health. And of these, you'll see some are behaviors, some are factors. We're going to be talking about just one of them today. Previously, we discussed blood pressure. Today, it's going to be cholesterol. A lot of these are very, very, very highly interconnected. So by helping one, it indirectly helps many of them. But the reason to kind of distill it down to 7 is there's always a bunch of kind of information floating around about oh, eat this, don't eat that. Oh, this is important. That's not important now. Statins, are they okay? No, I hear that they give you muscle cramps. There's a ton of information in a lot of directions. So it's easy to get distracted and kind of throw up your hands and be like, I don't even know what to focus on anymore. So the 7 are intended to kind of keep our eye on the ball and keep us focused on what are the key 7 things that are most important to optimize cardiovascular health. So that's the whole thing with the Life Simple 7. Excuse me. So today, like I say, it's normal cholesterol. The cool thing about this is that by age 50, if you've kind of established an ideal cardiovascular health and you've kind of done that by age 50, they calculate that you can kind of expect 40 additional years of cardiovascular, risk-free life. So in other words, there's no reason you shouldn't be able to make it to 90 without cardiovascular disease or stroke. That's the first and third killer really affecting you very much, which means that if we can focus on these, get these under control, it increases not only the quality of life, but also the duration and length. So the basic definition, here are the Life Simple 7 and also kind of the numbers associated with them. To go into them just slightly, smoking status, that kind of thing. Main thing with smoking, just real quick and easy, is it starts to help the day that you stop smoking. And it's the number 1, purely modifiable risk factor. It's completely just, it's just a human choice. That's it. There's nothing else really about it. And to be ideal, it means you've quit for over a year. That means that, it's not oh, well, I've already, smoked for for a good long time, that kind of thing. There's some permanent damage there, but they're finding less and less all the time that that you can't kind of overcome. The body has an amazing sense of actually repairing itself. And if we get out of the way of kind of putting it under attack from either environmental factors or kind of what we eat, what we do every day, what we kind of are exposed to in the way of smoking, that kind of thing, the body wants to be healthy, very basically. So if we kind of get out of its way, it will do most of the work for us. And this is coming from me, and like I went to pharmacy school actually before I became a physician. So I mean, like when it came to kind of like medications, drugs, things like that, like I was clearly all about that stuff for a good long time. But now it's like those things just facilitate the body's ability to heal itself. So less is usually more if you don't need it, that's for sure. Physical activity. We've kind of always kind of heard about like these kind of things, like 150 minutes per week of moderate exercise is kind of the ideal at this point. Healthy diet. The AHA has a great website just on Life Simple 7. They can do like a calculator and tell you like where you need help, where you kind of where you can optimize kind of for each of these 7. So I would definitely point you to there because diet's kind of a whole discussion just on to itself, and everybody hears a little bit differently about that, and those are highly individualistic for sure. Healthy weight, that's a BMI below 25. Again, BMI, that's kilogram per meter squared. So it's a component of how much you weigh and then how tall you are, both in the metric system, which we're not really terribly familiar with. So an online calculator for that is certainly really helpful as well for us. Blood glucose, that corresponds to diabetes. Cholesterol, which is what we'll be talking about today. They have the ideal numbers down there, but we're going to the guidelines just a little deeper here in a moment. And then blood pressure, of course, the silent killer, meaning that you don't usually have any symptoms of it at all until it's at a point where it's a real challenge. So a very highly, really important area there too with blood pressure we've kind of discussed in the past. So why focus on high cholesterol? Like why did that one make the top 7 list? You know, like why does it matter? Well, the main thing is like people with high LDL cholesterol, which we'll go into as being like the kind of the quote unquote bad cholesterol, it doubles your risk of having heart disease. Like that's a real challenge. Over 31%, so basically a third of the people have high LDL, and of that, only a third actually control it very well. So it's a very mismanaged challenge currently. So it's the AHA's goal to kind of bring awareness to it and talk about like how we can actually how we can make that better. So now the interesting part here, the steps to actually control your cholesterol. If you look through here, you have quitting tobacco use. Okay, there's your smoking. You're maintaining a healthy weight. Kind of discussed that one as well. Regularly exercising. Again, that's another one of Life Simple 7. Talking to a nutritionist and moderate moderate alcohol use, that kind of thing. Again, you're getting back to diet. So those are 4 of Life Simple 7. Cholesterol being the 5th. The other 2 being high blood pressure and diabetes. Now, if you get your weight, your exercise, and your nutrition under control, that pretty much is the main things that you need to do in order to help out with diabetes as well, and also for hypertension. Meaning that by helping, again, like the interconnectivity of the 7 is huge. So like if you help out any of the 7, if you were just to focus on cholesterol, you would indirectly be helping literally almost all of them. So it's a beautiful interconnected system that way, to where like helping any one helps nearly all of them, if not, a far majority. So that's a really kind of it's a cool, simplistic kind of feature of this. And also just the only real other thing out there is taking prescribed medications. There's a few medications that we've kind of isolated at this point, that the statins, namely being the main group, that have shown to actually be predictably helpful all the time. So understanding the different types of cholesterol and levels and whatnot, like first step is just kind of knowing the difference. There's 3 different types of cholesterol. You have your HDL, LDL. Actually, there's more components than that, but if we keep it as simple as we kind of can, you have your HDL, LDL, and triglycerides. Those are the 3 main components that fit into the equation of total cholesterol. So you have your HDL, which is known as your good cholesterol. Okay, it clears the excess cholesterol from your bloodstream, so that's positive. Usually found to be higher in females, premenopausal females, because estrogen is also associated with HDL. Also, if you work out, maintain a good diet, a healthy diet, also shown with an increase in HDL as well. Those are 2 ways to modifiably, well, you can't really modifiably change whether you're a premenopausal woman. However, like the diet exercise is a way to modify your HDL as well. And the LDL is considered the bad cholesterol. It's the one that usually gets all of the bad press. And when people are talking about, like cholesterol and not being happy about it, it's usually their LDL that they're talking about. So that's what causes the actual deposits in the arterial walls that actually leads to cholesterol challenges. So the components, to get into them a little bit more, you have your total cholesterol, you have your HDL, your LDL, and then also your triglyceride level. So triglyceride is just basically the fatty particles that are also in the mainly in diet there. So to figure out what the total cholesterol is, it's an imperfect metric. Certainly in my mind, because like you're adding good cholesterol and bad cholesterol together for a total number. In other words, like you can't, like, it's hard to say that the total number has a ton of meaning without knowing its components when you add together good and bad. So having a high total cholesterol usually will indicate that your LDL is high. But someone can have the same total cholesterol and literally have, like, one can have high LDL and low HDL, which would be bad, or they can have the alternative, which is high HDL, which is good, and low LDL, and they would have the same overall cholesterol. It usually doesn't happen like that, but it's certainly possible. Okay, and then the triglyceride level kind of fits in there as being kind of whatever the triglyceride level is divided by 5 or 20% of the triglyceride. So the most common reason that you see anybody that has like a total cholesterol, and that's what they're quoting, is somebody would go to like a community screening and whatnot like that, which is completely and totally great. Like there's nothing wrong with community screenings at all, but those are usually a great tool to take to your healthcare provider in order to open the conversation about getting probably a little deeper into the actual components and seeing kind of like where total cholesterol and how cholesterol fits into kind of the health plan, so to speak. So it's a good place to start. So at a screening, if you have a high cholesterol, it's a really great entryway to kind of know that that's a challenge and you need to kind of move that way. It doesn't really tell you all the information you need, but it's a really great screening tool, which is what a good like wide stroke health screening should be. So those are kind of the components that make up kind of a total blood cholesterol, so to speak. And when it comes to drug therapy, when we talk about like the treatment of cholesterol with the use of drugs, there's multiple different drug classes. Statins is the main one that I'll talk about today because the new guidelines surrounding them that came out a little over a year or so ago, they're the only class that they're directly associated with a decreased risk in heart attack and stroke. In order for people to, like, for the medical community to actually be able to say like that statement is much harder than what you might expect, because that means like literally like a lot of studies have to happen, a lot of things have to happen in order to be able to say that, like, listen, this actually directly associates people to have less heart attack and stroke. We have an idea that a lot of things are really good for you, but there's a lot of things we can't actually definitively say that for. Like, I can't say that spinach reduces the risk of heart attack and stroke, even though I'm pretty sure it reasonably would make sense that it does. There's just, there's not enough research to actually say that. So like statins they get a mixed bag of either like pros and cons associated with them. We'll go through that a little bit more here in a moment. But after the new guidelines, after they did a little bit more of a study, they have three main classes of people that at least the guidelines say to highly consider for people on statins. So, for example, people with a history of cardiovascular event. So if you have any cardiovascular problems, like in the past, if you've had a heart attack, if you've had a stroke, if you have cardiovascular disease, like it's highly probable that you may be a really good candidate for a statin. Anyone over 21 with a high LDL level of 190 or above. And then adults with 70 to 189. So like basically that's your number. And having either one of two things. If they have diabetes, then they're highly great candidates for a statin, or a 7.5% risk factor, which they have plenty of like little calculators online to kind of to assess that. And that's the online type stuff. Obviously, like your physician will do the same type thing of having a heart attack or stroke within 10 years. Those are so when you look at those kind of guidelines, they think that would put about 32 million-ish people on a statin. That seems like a ton of people. There's approximately 30 million people, they estimate, currently on a statin therapy, which really isn't that many more people than, like we have currently, so 32 versus 30. So when the guidelines came out, they got a lot of scrutiny because they thought, like, oh, great, it sounds like everybody kind of needs to be on a statin now. It's not really that many more people than what we have currently. It's just different and better people. I wouldn't say better people, more targeted people, getting the right people on an actual statin, not having kind of better guidelines upon why people would have a statin versus not. In the past, we had very commonly tried to treat LDL down to a specific number. So saying like, hey, listen, we want our LDL under, it depends on what disease state and whatnot, but like either under 100 or under 130. So if you were on Lipitor, for example, 40 milligrams, and like you weren't quite down as far as you needed to be, well, let's raise you to 80 milligrams to get you below that number. Treated for the numbers a good amount in the past, and that wasn't really terribly associated with increased or better outcomes, meaning treating for the actual number, meaning that it was more important just to have a statin and to have the lowering effect, and probably a lot of the other effects that are outside of the LDL lowering effects that are causing the decrease in cardiovascular disease challenge as being kind of the main reason why people are actually on a statin per se. So last type thing, common myths about cholesterol in general, like statins, they do more harm than good. That's a pretty common one that physicians hear and that people kind of hear circulate and stuff like that. This is a quote from Dr. Lloyd Jones, like very interestingly, the Northwestern here in Chicago. And I think that's a pretty staggering type statement to say that, like, if, don't be afraid of them. They're literally life-saving. And like to have the right people actually taking them could decrease the risk of cardiovascular disease to up to 50% in the coming decades. Like American Heart Association is looking to decrease it by 20% by 2020. He's saying that like if just people would take the right people would take a statin, you could decrease it by 30 to 50% just by that alone. That's a singular agent that could cause that kind of decrease. So there's been a lot of research and whatnot along the lines of kind of risk benefits and whatnot with statin. And there are certainly patient populations that they don't do well with, that they don't agree with at all. But by and large, they're associating more and more things that they, at least they don't know if they're causal, but they're certainly correlated with better outcomes. Everything from Alzheimer's to colon cancer, multiple cancers actually. they think the best of my knowledge is that we're all under the impression that like it decreases inflammatory response of the body, much like not in the same way that aspirin does, but in the same unknown to us way that aspirin does, like where it kind of decreases inflammation here, there, and everywhere. So to where like a little statin is not terribly a horrible thing, almost when you're looking at a population health type perspective. Now, clearly, that's a drastic oversimplification. So it's not that everybody should have one, but at the same time, the threshold for prescribing, I think, will continue to get lower and lower for that. Other big myth: high cholesterol runs my family. There's nothing I can do about it. So there are things that you can do about it. Everything from diet, and also like diet modification, any of the Life Simple 7 type changes that we kind of discussed. Those are the real large type things that we can do to kind of help out. And also, yes. Yes. So, yeah, everything with like Life Simple 7 in the way of like working out, like routine exercise, stuff like that definitely helps. And then also if it runs in your family, like there's certainly a familial component. Those are really great candidates for oftentimes for drug therapy, like where diet and exercise very well may not be enough. The other modifiable risk factors, they may not be able to get you to the place you need to be. But like to throw up your hands and say there's nothing you can do about it, we don't want people to feel as disempowered as that, for sure. Another thing that a little less so now, but still kind of always comes up, like as a woman, I don't need to worry about high cholesterol. It's kind of a men's thing that like guys have to worry about more than the female population. The American Heart Association has done a really good job over the last, what has it been, 12 years almost now, that the Go Red for Women in February, it's coming up, where you'll see little pins for red dresses and stuff like that, because like it's an amazingly alarming rate that women will be affected with cardiovascular disease. Like I think it's like almost 3 times. It's 3 times more likely for a woman to die of heart-related disease than breast cancer. Breast cancer is like a very gets an awful lot of attention. So it's kind of changing kind of the conversation a little bit to make it even more awareness to the fact that like this is something that concerns both sexes, both men and women, for sure. Yeah, this is a good. I went to a cholesterol screening 10 years ago. They said it was fine. That is awesome. The guidelines now recommend that like you get a good checkup, and this is part of your normal kind of screening panel every 5 years. So it's fantastic that everything was great 5 years ago, but we want to make sure that everybody gets checked starting at age 25 now, is what they say, every 5 years. After 25, you should have your kind of like a checkup that's at the bare minimum without anything else at all, like just healthy. You should have that kind of frequency and kind of know your numbers, so to speak. And the last one, my doctor didn't mention anything about cholesterol, so I must just be fine, no problem. He didn't say anything about it, so I'm good. This is one that a lot of my family members, strangely, this may not be just isolated to my family, I'm assuming, but this certainly happens there. To where like, I didn't say anything, I think it's fine. That doesn't necessarily mean that. Like as each of us has to be an advocate for our own health. It's not that, physicians and healthcare teams and whatnot don't have your best interests at heart as well. But it's your job to advocate for your own health. Like you have to make sure that, nobody's going to care as much about your health as what you do. There's just no other way to put it. So just because they didn't mention anything or whatever, be an advocate, ask, how did that go? How was that? What were my numbers? I'm going to be putting them into a little calculator online to see how like what I can do to kind of improve my cardiovascular health in the event that your healthcare provider doesn't do that for you. You'll need to know what the numbers are. So it's important that you keep track of that and like, really take an active role kind of in your overall management of your health. So those are the big common myths of cholesterol. That's all I have for today. Thank you so much for sharing this information with everybody else. I really appreciate it. And now we're open for questions. Let's see. We don't have any quite yet. So throw in any questions that you have on cholesterol in general, and we'll have a little question answer session here. I won't like anything that you'd like. It doesn't absolutely have to be cholesterol related, anything having to do with cardiovascular disease. But if there's anything in there, I'll just kind of wait for you guys to pop them in there if you'd like. All right, first question we have, does pregnancy affect your cholesterol levels? Pregnancy affects everything. It most certainly does. I can't remember exactly how it affects them. It's extremely uncommon that people will change their they'll change their regimen around pregnancy when they're pregnant, as far as like what medications they take, stuff like that. Like review with your doctor. A lot of times, if you take medications, a lot of times what they'll do is they'll remove those during the pregnancy, oftentimes, because usually I wouldn't say it's kind of a risk reward type association, usually going without them for a certain time period. Nobody really wants to do studies on seeing if like Lipitor or statins or anything like that are healthy for a pregnant woman. So it's oftentimes that we won't be able to gather great data on that kind of stuff for a really long time, because usually people will self-select themselves out of those studies. Meaning that like if it's hard to get a pregnant woman to sign up and say, oh yeah, I'll sign up to trial a drug while I'm pregnant. So it's really hard to actually know exactly how it all works out. That's usually a great one for kind of your physician in the event that you need to. But to my knowledge, it doesn't change them drastically. Pregnancy alone doesn't really change them drastically. Okay, next question was, why did the recommendations change from less than 200? So overall, in general, like the recommendations, they became like a whole lot less number centered. Just in general, like whenever they do like a meta-analysis, which is some of the beautiful, the beautiful thing from a data analytics standpoint was that there are so many people that were currently taking statins. Like there were a lot of people. That gives you a lot of data to be able to go through and to be able to actually make a good amount of associations for it. So whenever they did that, they teased out that like the exact number wasn't quite as important. And then also like the combination of other factors around not just the number of cholesterol. Like, don't get me wrong, it's so easy and it's so nice to be able to say, like, oh, like what is it? And your cholesterol is 204. Excellent. Well, I need to prescribe you this drug, and this drug. That's like an algorithm. That's beautiful. It's easy. It's extremely easy for prescribers to be able to do, but it's just not that simple. It's a combination of a lot of different factors that happen. Now, one of the cooler type tech ideas and kind of movements here in the next decade or so are kind of computer-based learning, deep learning algorithms, to where it's really hard for us to know which medications work really well for which population. Say, for example, you are a Black female, age 74, with congestive heart failure, obesity, diabetes, and some acute renal failure. And you also now are diagnosed with increased cholesterol. That's a lot of factors. If we have everybody on an electronic medical record, at that point we can know, like, okay, so for people that fall kind of within those parameters, not only like sex, age, You know, like if you go down the algorithm and you actually select for that, you can see kind of for that set of challenges, or not challenges, like that set of specifications, what's the best drug therapy? And then you get into even cooler things, which is actually pharmacogenomics, which is, sorry, I'm slightly off topic with this one, but like pharmacogenomics is even more amazing, like getting your genome sequence and by your genes being able to activate genes that that facilitate your health instead of like being not so great and negative for your health. Like why whenever you eat a salad, it doesn't do the same thing as when this person changes their diet and they have, you know, like the same diet as what you do. Like people respond in very different ways. A lot of that has like, there's a good amount of genetic component with that. We don't understand that at all, but there's now genome sequencing that's happening as they get more data, as we associate that further and further with new deep learning algorithms where computer-based learning can actually like provide a good amount of answers for us. Those are going to become completely and totally great. And it makes it to where like the numbers alone will be like one of the really like cluster of components, like a lot of components that are actually going to be kind of measured, and it'll be a little less than a singular component. Next one, can stress play a role? 100%. Yes. Like even there's good research actually around transcendental meditation. Strangely, like lowering cholesterol rates, lowering overall cardiovascular disease rates. I say that because like there's not a whole lot of organizations that will tackle and actually like show like to prove those things. Like it's a little bit hard. Like I was saying, like spinach. Who's doing the research on that? Like who's going to pay to have the research on that done to kind of prove that that's the case, even though intuitively you know that it's probably correct? Stress, there is a fair amount of research around everything from meditation, mindfulness, stress reduction type ways, such as everything from yoga. Sometimes time with family can be less stressful, but not always. But yes, stress 100% plays a factor and a role in not only cholesterol, but also like a variety of different inflammatory factors around the body, which is again probably the main reasons that probably is one of the main reasons that the statins are even effective anyway, is in kind of decreasing like inflammatory response, which inflammatory response happens with stress, whether it's psychological, physiological stress. So yes, 100% plays a monstrous role in there. Excellent. What are side effects of taking statins? So statins have a good large, they have a really well documented kind of side effect profile. The most common ones that we hear as physicians that are being kind of noted would be around muscle weakness and muscle fatigue. Those are kind of the biggest ones, kind of like myositis type symptoms. Those are usually they're usually the most pronounced, and the reason why most people usually don't tolerate them. Those are the usual like most intolerable things, and usually like those can be kind of synergistically amplified by other medications, such as like the fibrates. That's another class of statin medication, and other medications as well can kind of make that a little bit worse. So at that point, it becomes like like a physician needs to kind of will obviously be involved anyway, but to kind of modify like how important like what's the risk benefit on that kind of thing, like adjusting the drug regimen to be optimal for what's tolerable for the patient. That's the most kind of common thing. So next one, what specific dietary suggestions would you give relative to cholesterol? What foods to avoid? What foods are best choices? So like there's really great resources on this in particular, because it's a really big category. I'll do like a like kind of the big high overview, but like in depth and whatnot like that. Life Simple 7, if you just throw that into your Google, they have like a nice calculator, and they go into a lot of information on, like food choices like that we can show through cardiovascular studies that are the very best for you. In an extreme nutshell, like when it comes to cholesterol specifically, you need to know your fats, basically. Saturated fats, you want to steer clear of saturated fats at all junctures. A lot of those have to do with red meats. Red meats are usually a really big culprit that they put behind it. But when you start looking at like triglycerides, which also kind of fit into cholesterols as well, you can do your simple sugars and whatnot like that as well. So it's been a really big thing for the AHA this last 5 years. Like they've really taken on things like sodas or any sugary beverage. Like you can ingest a lot of calories and B, a lot of the wrong calories that are definitely not cardiovascularly friendly in kind of like those kind of beverages. So like what to eat and whatnot like that. The whole adage of, like lots of like fresh green leafy vegetables, like tons of vegetables, your protein source, usually from everything from, like legumes and fish, especially with the omega-3s. Omega-3 fatty acids have been shown to, like they are fats and whatnot like that, obviously, but they've been shown to be very helpful in actually lowering cholesterol. So those are the right kind of fats versus the saturated fats that are considered to be more negative. So like those are kind of your best choices, like your fish and stuff like that for like the protein sources, and lots of fruits, vegetables, that kind of thing. The sugary whites, like basically the adage of like not eating anything white, is of course again an oversimplification, but not terribly a horrible one from the standpoint that like you're not probably ingesting a lot of the simple sugars that you would otherwise through like breads, pastas, rice, stuff like that. So next one, I have one here that says long term. If you can fill that out just a little bit more, and I can, I'm not sure exactly on that one. The next one, what about eggs? Used to be bad, now they're good. Yeah, you're exactly right. Like they go back and forth. It's stuff like this that makes the dietary component so absolutely confusing. Just in general, like egg yolks have a lot of cholesterol, therefore they should be bad, right? Okay, don't eat those. Only have egg whites. Now, like the full egg is like considered to be okay. So like, eggs are an interesting type thing. So like, especially with the yolks, you hear one way and then the other. Like so, when it comes to like in general, when it comes to just eating, moderation is key. When it comes to all of those things, like just mindful moderation almost always will win, and when I look at an egg, like especially just eggs in general, if you get really specific just as an egg, the yolk, the whole reason it has yolk versus like the egg white, like the egg white is a constitution of all the amino acids and everything within a closed system that a chick would actually need in order to grow into a chick from an embryo. They don't have any outside source of nutrition. Therefore, it's kind of a perfect complement of all proteins in a sense. So egg whites, it's really hard for me to justify how that would ever be bad for you. Like other than egg allergies, stuff like that, obviously, but like the egg white, really, like that to me makes an awful lot of sense that should really promote pretty excellent health. Now, as far as the yolk, that kind of thing, that'll go back and forth. Yeah, that one always changes with time, strangely. Are there any easy dietary changes that someone can make? I kind of covered that a little bit, but yeah, like it's usually in the elimination type thing. And little changes are good. Like don't try to, like dietary changes are almost like, I heard one patient say that it's kind of like trying to take a bite out of a beach ball, where you don't really know where to start or how to get your first bite, and it seems really daunting. Like just little things at a time. Like a lot of times it's just kind of a substitution, like just substituting one thing with another, like sugary drinks. If you really like, like kind of sugary drinks are like the easiest example to kind of like go at and stuff like that. Like even, like switching, it's usually a substitution and switching thing that, like I say, on the AHA, it has like tons of those things. It's so highly individualistic on like what it is that your kind of Achilles heel is. So if you do a little food journal or anything like that, you kind of know what you usually eat. And if you just substitute a few things here and there, those are easy things that can change and really help you really long term. Back to the prior slide. What would you recommend? What was the recommended amount of exercise? Yes, let me go back to that. Yeah, absolutely. So recommended amount of exercise, 150 minutes of moderate exercise, and I think it was 75 of relatively vigorous exercise is considered, and that's per week. So like that's 150 minutes is not that terribly long. That's 20 minutes-ish per day. It's just 20 minutes, and that's moderate exercise. Moderate exercise is like, that's not that crazy. So like we're talking like going on a walk, moving. Like moving is a really, really important type thing. Like just moving. There's another system in the body that doesn't get quite as much press as like the cardiovascular system. It's called the lymphatic system. And the lymphatic system, when blood kind of goes out the arteries, comes back in through the veins, it goes through capillaries, but also like there's other stuff that like it doesn't all make it back through the capillaries, and like just scavenger system of like like white blood cells that kind of help out to fight off all these bad demons in your body and whatnot like that. There's no natural pressure system for that system of lymphatic flow. Like the natural pressure system is actually breathing. Like your biggest mechanism for moving that is through your diaphragm, through breathing, and also through movement. It makes its way back. So if you're on a long flight, and you notice at the end of the flight that like literally your ankles are, like a little swollen after that. Like they just seem like they're just retaining a little bit more fluid. That's the lymphatic system that's actually like it's retaining. How do you get that to go away? You walk. Like it has to naturally kind of get back there, but it happens through like breathing, and it happens through movement. And by moving around that inflammatory, like rich kind of system, it promotes health by kind of like look at it as waste products. It needs to be cleared. The longer it kind of sits there and actually is around the cells, the more chance it has to cause problems to those cells, which can therefore replicate that problem. That's how cancer happens. Like it's kind of moving, like it's moving around all of the inflammatory and kind of the sewage system of the body. But that doesn't happen. Like we don't have a really good component of that. So like to me, a lot of the component that has to do with exercise has to do with like increasing lymphatic flow and getting the sewage system, so to speak, in your body kind of moved around. Like if you've ever had like like you haven't had a massage in a really long time or whatever, and you have somebody that gives you a massage, like they'll always say, usually at the end, they'll say like drink a lot of water and whatnot like that. Why are they doing that? You're kind of flushing your body, because what they just did, they just moved around all of your lymphatic flow, everything. So you might notice the next day that you're a little bit sore, and doesn't have to be because like they were heavy-handed or anything like that they actually made you sore. They just moved around all the lymphatic flow, and you're just clearing it. So you're kind of like a little dazed when you get up, and you're a little sore the next day. So like keeping movement kind of going, that's it's so super important for your health in general. All right, excellent. That's the end of the questions. Anybody else? Anything else? Anything that I didn't fully address that anybody wants to know more about or whatever? Cool. Well, thank you guys so much. I'll stay on here for a little while. So if anybody has anything else, go ahead and feel free to put it in here. I'm happy to talk about anything else you would like. Otherwise, thank you guys so much for attending. And like I say, Nicole's done just such an amazing job. Like they've coordinated to have it to where they have the learning exercises now of CPR and ACLS, PALS, BLS. So please jump on Medline University and go to the just take the course on how to like do CPR, how to do, you know, like don't remember how to do the Heimlich maneuver, like just learn how to do it. Like it's all free, it's all there. Like just it empowers you to be able to kind of save a life and be able to help out in the event that you would ever need to. Hopefully that'll never happen, but it's a wonderful thing to be able to feel like you would be empowered to actually do something if in the event that you found yourself in that situation. So it's on Medline University. Feel free to like jump on there, check it out. They did a really great job putting everything on there and getting it all together. So thank you guys very much. And oh, Scott, we got one more. So about how long should I expect a lifestyle change to be reflected in my blood cholesterol? How long should one expect a lifestyle change? It should, if I'm reading that correctly, so blood cholesterol levels change. Usually they won't have anybody actually like check them more than every 3 months, because it takes about 3 months to see any sort of change, whether it's diet, exercise, any real change, even medication. It usually takes about 3 months for that system to have a reasonable, measurable change. And as long as you change something and you don't revert back, there's no reason to expect that you should not continue to see that positive change. Now, if you were to, you know, like be like, I'm going to eat really well for the next 6 months, and like you get your, you know, like your cholesterol and whatever, like checked again, like everything's like, oh, it looks a lot better. Everything looks really good. Like you're actually like, you're in a much better state of health right now. Like, you know, like at this moment, you're like, good, I'm glad I don't have to worry about that anymore. And then you revert back to those things, like whatever kind of was happening before. Like there wouldn't be a whole lot of reason to predict that those changes would stay for you. You know, like it's one of those things like you have to do it every day. You know, like when it comes to like physical exercise, it's 150 minutes a week, each week. You know, like moving forward as well. Like, so I mean, if you're 90, that might just mean like you're going and taking a 10-minute walk in the morning and a 10-minute walk in the afternoon, or whatever, you know, like physical exercise you can kind of do. But it's one of those things like it's kind of a sustainable life change type thing. So cool. Well, awesome, guys. Well, enjoy your day. And thank you guys very much for being on the call. And if you have any questions for me or whatnot that you didn't think of here, I think on the last slide I put my email address. Hopefully I did. I'm jumping back to it here real quick. So if something comes up for you a little bit later, oh, it wasn't on there. Well, in any event, it's carl.disc@disquefoundation.org. So please feel free to email me in the event that you would that you'd like to. You can reach out to Nicole. She can get you all connected with me as well. But I'm happy to answer any questions that you may have. All right, sounds good. Thank you so much, guys.